Next, coding guidelines for ICD. Introduction. Accurate ICD requires strict adherence to established guidelines that ensure consistency, specificity, and compliance. This module covers the official coding guidelines provided by health authorities, which serve as critical tools for proper code selection, sequence, and documentation interpretation. Purpose of ICD coding guidelines: standardization to promote uniformity in diagnosis coding across different providers and settings, accuracy to ensure codes accurately reflect clinical conditions based on documented evidence, compliance to help avoid billing errors, audits, penalties, and potential legal issues, support for data collection to facilitate reliable health statistics, research, and public health reporting. Sources for coding guidelines: official coding guidelines. These are published annually by the Centers for Medicare and Medicaid Services and the American Medical Association, also referred to as AHA. ICD-10-CM official coding convention and instruction manual. It is the primary source for coding instructions. Next, coding clinics. These are published by AMA, providing updates and clarifications. Next, key components of coding guidelines. General coding guidelines. Follow the instructions for code assignment, sequencing, and documentation. Use the latest code version and avoid outdated codes. Next, inclusion and exclusion notes. Clarify which conditions or codes are included or excluded in each category. Next, use of and or in guidelines. Definitions specifying whether conditions are coded together or separately. Etiology and manifestation. These include guidelines on providing primary conditions and their manifestations, and use of combination codes where applicable. Next, coding principles and practices. Use specific codes. Prefer the most specific diagnosis code supported by documentation. Sequence correctly. List the principal diagnosis first, followed by secondary diagnosis. Address uncertain diagnosis. When diagnosis is uncertain, code as documented and follow guidelines. Avoid unbundling. Do not separately code components that are included in a single comprehensive code. Special guidelines. Laterality. Always specify a side when relevant, such as right or versus left. Encounter note types. Different codes for initial, subsequent, or sequela encounters. When documentation is incomplete, Use unspecified codes sparingly and only when supported. Updating and maintaining coding compliance. Stay current. Review updates and new guidelines each year. Training. Participate in ongoing education and review of changes. Auditing. Conduct regular internal audits to ensure adherence to guidelines. In summary, ICD coding guidelines are essential tools for ensuring accurate, consistent, and compliant diagnosis coding. Mastery of these rules support precise reimbursement, quality data collection, and minimized audit risks. Always base coding decisions on clear, complete documentation and adhere strictly to official instructions and updates. Thank you.